gotta do.
Alright, so I'm going to perform my hand hygiene at my station. So I'm going to pull my drugs. So first I see on my MAR that I need to have acetaminophen. So I'm going to go ahead and pull my acetaminophen. The MAR calls for 650 milligrams twice a day. And on my pill bottle it says 325. So I'm going to do my dosage calc. Do 650 divided by 325 per 1 milliliter. So I'm going to be giving the patients 2 pills of acetaminophen. And so I'm going to check it one last time before I take it off. If I can get this thing to pop. There we go. So I'll get this ready. Alright, and so next I see a, so I'm going to cut this back actually. Okay, and then I'm going to go ahead and pull a fluoxetine 0.3 optic drops. So that's going to go for our ears. So I'm going to pull our medicine out. It says, okay, it's the correct drug with the correct 0.3, and it is not expired. So I'm going to put this with my acetaminophen after I double checked my checks twice. So then I'm going to pull off Pliocarpine 4% eye drops. So I'll pull this out. And I'll double check, compare it to my MAR, that is the correct drug, and no dosage calc will be needed because these are the correct doses. Okay, and so then I'm going to pull my insulin because I have to give insulin to my patient. I see that my patient's blood glucose is 306, so I'll subtract that by 100, divide by 30, and I have 6.8, so I will round that to 7 units of regular insulin, and then the MAR also calls for 6 units of NPH. So I'll go ahead and get that ready. So here's my NPH insulin, and I'll go ahead and double check and make sure everything lines up and it is correct. And then my regular insulin, make sure that's correct as well. So then, before I do this, I'm going to take the alcohol wipes and I'm going to cleanse the tops of our insulin off. We're going to do those so they can let those dry. And then we're going to uncap the insulin syringe. And since we have 7 regular units of insulin, we're going to plus the 6 units of NPH, which is going to be 13 units. So I'm going to pull back on my syringe. 13 units. Okay. And so I'm going to go into my cloudy and I'm going to eject the 6 units. And then in the rest, I'm going to put in my units of here. I'm going to pull back my 7 units of insulin. And then do the rest of my 6 units of my NPH to make 13 units. And I'm going to go ahead and recap my insulin. Okay, and so my last drug I'm going to pull is haloperoxide lactate. So I can go ahead and put these back while I'm doing this. So I make sure that I put my regular insulin in here and my NPH right here. And I'm going to pull the haloperoxide lactate. So I'm going to double check to my MAR, make sure it's the correct percentage. So this is going to call for 5 milligrams. So I'm going to do my dosage count and do 5 milligrams divided by the 5 per milliliter. So I'll be doing 1 milliliter of my haloperoxide lactate. So I'm going to go ahead and pull this out, as well as my correct needle, which I'm going to be using my, if I can pull it out, give me just a second. My 22 gauge, and do the length for 1.5. So I'm going to make sure I do this, and so I'm going to cap it, and I just confirmed with my dosage cap I do 1 milliliter. So I'm going to go ahead and pull it out. And I'm going to hit the thing to block out any bubbles. And I can go ahead and recap it and get ready to walk into my patient's room. So I'm going to walk into my patient's room, and I'm going to perform hand hygiene, and I'm going to ensure the patient's privacy. And while I'm doing that, I'm going to introduce myself. So, hi, my name is Haley. I'm going to be your nurse today. And then I'm going to go to my patient and ask them their name, give their name and date of birth. So Mr. Voss confirmed his date of birth, and I'm going to make sure he has any allergies. We've already checked on the MAR before that the patient doesn't have any allergies to the medications we're going to give. So I'm going to go ahead and pull him up to a comfortable height. And while I'm doing that, I'm going to go ahead and get my gloves ready. So I'm going to put him in a semi-Fowler's degree. So I'm going to put him about 60 degrees. And then with my medicines, I know that I have a tablet, so I need to make sure that there is water for the patient to drink. And then I'll get a couple cotton balls to help me with my ear and eye drops. So after we can check, after we confirm the patient's date of birth, we're going to explain to him that we're here to give him his medicine and what the medicines are going to do through our 6 rights, which is right patient, right dose, right time, right route, and right documentation. And I've done my 3 checks, so my 3rd check will be done at the bedside. And so first I can make sure I get him up more comfortable so that he can easily, and you can ask them if they've had any surgeries with their ears, their eyes, and have them swallow just to confirm that they're able to take pills. So I give him his medicine, give him some water, and then you double check to make sure that the medicine's there, like it's been swallowed, so it's not withholding it. And then for my eye drops, I checked my MAR one last time, and I see that I give my eye drops to the left eye. So I'll get a cotton ball, walk over to my patient's left side, use my non-dominant hand to hold the cotton ball underneath the patient's and pull down while I pull the top up, and drop 1 drop to the left eye. I'm going to hold the lacrimal duct for 15 to 30 seconds just to make sure that the drops do not run into there. And so after that, the eye drops are complete. And then I'm going to move on to my ear drops. So I check one last time that the aura lines up correct. And then there's 5 to both ears. So I'm turning the patient's head to the side, pull the pin up and down. I would administer the 5 drops. And then I'll hold the, I cannot remember the name of it. Is it Tangus? Is it Tangus? You'll hold that, Tragus? Okay. You'll hold that for a few seconds just to make sure that it's in the ear. And while I'm doing that, you don't really want to do the patients for 3 to 5 minutes. So I'm going to go ahead and administer my injections. So first I'll give him my insulin and make sure my doses of insulin were correct. But altogether, he has his 13 units of insulin. From there, you cleanse the skin. So go ahead and wipe the skin off. Then you're going to pinch the skin and put the insulin at a 90-degree angle and pull out, and you'll have gauze, or you can hold it. There should not be any excess bleeding, but if so, you can use a Band-Aid. And then from there, this would be done on either umbilicus or on the back of the arm. And then we'll do our last injection before we do administer the next set of eye drops, which will be our intramuscular Injection, I'll double check on the MAR, make sure that I have the correct dosages done. So we're going to do this on the dorsogluteal, so this will be done on the hip, so you'd expose only the hip. You would put your palm on the greater trochanter with your thumb facing towards the groin, and you would administer between your 2 fingers. So you would take this one, again, you would cleanse the skin, and then you would pinch, do this as a 90-degree angle, and just push through. In other cases, you could pull back to see if there's any blood to make sure that you're not in a blood vessel. For this one, again, you would hold cotton ball, and if more bleeding occurs, you would put a band-aid on it. So all of those are done. So the last thing we need to do is make sure that our patient gets the ear drops to the other side. So this one should be fine after this time. So we can go ahead and take this out. I'm gonna walk around. And move his head over. Again, pull the pinna up and back, drop my 5 drops, hold the trays, and then again for another few minutes and keep that in there. So after that, while that is going on, I can be cleaning up my materials. So before I leave, I would move him back down to a comfortable height, ask sure if there's anything that he needs before we go. We'll be back in about 15 to 30 minutes to make sure there are no side effects with the drugs. So after my station is clean and he's comfortable height, I will remove my gloves and I will perform hand hygiene. And that's it.